Hi, my name is Evelyn Sue, and I'm the division head of the Division of Pediatric Gastroenterology, Hepatology, and Nutrition. I'm so happy to talk to you about our division and hospital today. So this is the hospital that we work at, Seattle Children's Hospital. In 1997, Seattle Children's Hospital was actually Children's Hospital and Regional Medical Center. And I wanted to bring up some of these slides just to highlight all of the growth that we've seen in the last several decades. This is before all of the buildings kind of that started to be built up in this area. This area is where the next photo was done in 2003 when we built this inpatient side of things of the hospital. In 2006, the Gates legacy really helped us to establish this ambulatory care center at the top of the hill, which is where we see a lot of our outpatients. And then in 2013, we built Building Hope on the Seattle Children's main campus, which is where our ICUs, ER, and a lot of inpatient rooms are. In 2022, the Building Care was opened, and this was just a very beautiful building that was built to house a lot of our surgical and procedural areas, as well as some inpatient beds as well. So speaking a little bit about our divisional mission and values, for our division, our mission is to improve the lives of children with gastrointestinal and liver diseases through excellent clinical care, a relentless spirit of inquiry to advance medical knowledge, and the training and education of the next generation of gastroenterology, hepatology, and nutrition leaders in a collegial environment which embraces diversity and promotes inclusiveness. And you can see the values that are listed below, which are Seattle Children's values of compassion, excellence, integrity, collaboration, equity, and innovation. But we have a vision for our division, which is thriving academic physicians providing excellent clinical care. And what I'd like to say is that, for us, it's important for us to be brave, to do the right thing always, no matter what, and to have fun. So hopefully that gives you an idea of kind of who we are and stand for as a division. A few hospital facts, our patients and the demographics of our patients are such that it's very important for us to consider EDI issues as we are providing for a large swath of the community that we serve, and be making sure that we're mindful to issues of health equity and of anti-racism and really everything that we do. Listed there are top 5 reasons for inpatient admissions in the hospital, as well as top 5 outpatient services. What's different about our hospital has to do with our location. So Seattle Children's serves as the pediatric and adolescent academic medical center for Washington, Alaska, Montana, and Idaho. And then really for our patients, we see even patients from Hawaii, from Oregon, and serve those patients for outreach sites, as well as education, and to serve as a resource for the doctors and the pediatric gastroenterologists that are practicing there. With regards to our overall facilities, we see ambulatory patients in main campus, as well as in all of our satellite patient clinics, patient days, ER visits, all listed there, and total licensed beds of 407. That are distributed in the way that you see. Our team is huge, almost 10,000 active employees, 2,000 medical staff, 2,400 research workforce, and our volunteer staff. But of course, kind of most importantly, the total physicians in training, over 1,000, and medical students in training as well. For the GI division and outpatients, we provide nearly 10,000 clinical visits across multiple sites and telemedicine. We are the tertiary and quaternary referral center for liver and intestinal failure transplant, advanced endoscopy, and motility programs for pediatric GI practices in a 6-state area spanning 3,000 miles. And so in the hospital, we provide care for GI luminal service, GI consult service, and the lift wards and consult service. This is a distribution of all of the team members that the GI division encompasses, and that goes from faculty physicians, advanced practice providers, of course, our fellow physicians, supported by ambulatory RNs, procedural RNs, administrative support, clinical research assistants, schedulers, dietitians, psychologists, social workers, all to really help us provide the care that our patients need. And then I just wanted to highlight the work specifically done in our division with regards to research. We have 58 IRB approved studies across the spectrum of disease. In the $6.6 million of funding for GI and hepatology investigators since 2012, helping us to contribute to cures for viral hepatitis, acute liver failure, inflammatory bowel disease, eosinophilic disorders, motility disorders, intestinal failure, and disorders of gut-brain interaction, not to mention all of the support that we provide for patients who have those conditions. Celiac disease is inclusive of that. I wanted to highlight the work of Dr. Jared Scarlett, who has been awarded national research awards for all of his work in working towards finding a cure for diabetes and the modulation of that and the other parts of the of physiology and signaling pathways. And he's just absolutely brilliant, and we're so happy to have him. So just to highlight our training and education of the next generation of leaders, our fellowship has been in place for more than a decade now with really esteemed graduates that have gone to all manner of experiences and work. And you can see them all listed here. Additionally, we have had a transplant hepatology fellowship for the last, better part of the last decade, and all of whom who have done very well and worked and are working in multiple academic centers across the nation. So overall, our mission is to prepare you to be an independent, successful, and thriving pediatric gastroenterologist. And I hope that you really consider joining us here, as I know that we are really strong in our mission, in our values, and it's a great place to be and to live and work, which is why we all choose to be here. Thank you so much. And I'm so excited to meeting you. Take care.